and welcome, and thank you for joining us this evening. My name is Rovina Nimbalkar, and I'm the Executive Director of NAMI Santa Clara County. I'm really excited to welcome our panelists, but before I introduce them, I will give a brief overview of NAMI Santa Clara County, the host for today's event. The mission and values of NAMI Santa Clara County is to help people with lived experience of health issues and families by providing support, education, and advocacy. We provide several programs that include educational classes like family to family, peer-to-peer, provider education classes, support groups, warm line, etc. We're currently providing all our classes and support groups online. Our classes are led by families and individuals with lived experiences. You can get more information about our programs by visiting our website, www.namisantaclara.org, or calling our warm line number, 408-453-0400. With that being said, I would like to introduce the panelists. Our first panelist is Dr. Kenneth Rosenberg. Dr. Rosenberg is an award-winning producer and director with 6 films on HBO and 3 films on PBS on mental health issues. He's a creator of the Bedlam movie. Dr. Rosenberg is also a psychologist, a speaker, and an author. He's been featured on NBC and CNN. Our second panelist is former Senator Jim Beall. Jim Beall's vision and experience has provided Silicon Valley with 30 years of leadership, making a difference in the lives of working families, seniors, foster care children, and people with disabilities. Our third panelist is David Mineta. Dave's career has strong roots in Santa Clara County. He worked for 14 years as the Asian American Recovery Services Deputy Director in the Bay Area, and currently Dave is the President and CEO of Momentum for Health. And our fourth panelist is Allison Murray. Allison has worked with NAMI since 2003 and has been involved in mental health throughout her career with Hope Services Counseling Center since 2012. She's been active and doing well in her recovery since 2005. And now that I've introduced the panelists, I would like to introduce our moderator for tonight, Maureen Milo. Maureen is a veteran journalist and the former editor of Silicon Valley Business Journal. She's also a family member with our NAMI Santa Clara County affiliate. Over to you, Maureen.
Thank you, Ravina, and welcome everybody. It's a pleasure to be with all of you today. Before we begin, I would like to congratulate Ken for last night's 2021 DuPont Columbia Awards for Bedlam. Thank you, Ken, for producing such a remarkable documentary on mental illness and how you speak the truth about it. All of us at NAMI understand this intimately as family members and consumers, so thank you for that. Okay, let's get started. If possible, we all know that we're on a close schedule, so a 3-minute window will allow you to hopefully discuss all our topics today. And of course, if somebody has a comment that they want to add on to another panelist, please don't hesitate to do so. The first topic I'd like to begin with is housing. Under the umbrella of housing, there is a cohort of advocates who feel strongly that housing the mentally ill and those with substance use disorders is the first step to recovery. The logic may be there, but it is much more complicated than a roof over their heads. Without proper treatment and continuity of care, housing is just not the only cure. Jim, I'd like to start with you on this. As someone who's been at the forefront of mental health advocacy in California for more than 40 years, first as an assemblyman and then senator, do you see housing as the primary solution?
I see it as a big part of the solution. California has done such a poor job at the state level until recently on housing for mentally ill. They took some of the Mental Health Services Act funds and set them aside for No Place Like Home, $2 billion housing program for mental health. There's going to be in this current legislative session a proposal for a $10 billion housing bond. And that should, of course, include more money for No Place Like Home mental health housing and supportive housing. There's no doubt that housing is part of the solution in terms of therapy. You can't really have a successful therapeutic plan if the person's homeless with mental health. You have to have a safe, decent place for them to live. So I think it's recognized by the legislature, the governor also. We just need to have an ongoing program for housing. And I'm pleased that the governor is also putting in the Medi-Cal waiver application to the federal government from California that the Medicaid funds can be used for housing. So that's another win that we achieved in this last year. So the bond bill is, I believe, SB 5. It's going to come up. We should all testify and say we want mental health programs to be part of the solution there.
Okay, thank you. David, same question with a little bit of a twist, of course. At Momentum, you have a housing component with 24/7 residential care, which offers step down to support housing and then independent living. Can you talk about that model? Because in there, you do have integrated services as well.
Yes, thanks, Maureen. And, I just wanted to support what, State Senator Beall former State Senator Beall was talking about. Jim's done such a great job in trying to fill in the system and for housing and, with services, connected services. Part of the issue, I think, though, is that across the entire continuum, right? So for housing or residential services that have treatment, step down into supported housing to independent housing, there needs to be more across that entire range of housing options for folks. And, I think that Dr. Rosenberg in the movie made that, just by showing where people were out in the community, showed that really clearly. People living at home with their families, but then they couldn't because they became more acute, and then they needed services, and then they needed step down in the community again. Transitional housing. So across the whole range of housing opportunities, I think we just need to do a better job, as Jim said, across that entire range. And because our treatment residential care is just one part of it. When someone is needs more services and housing, and then they can step down into more outpatient services and then and then housing, and then some are completely independent, and they may just come in for medication monitoring, maybe, or a support group, alumni support group, and so could be living on their own in recovery just fine, thank you, just fine. But we need to actually then pay more attention to the entire system across that, that range.
Thank you. So Ken, in Bedlam, racial disparity played an integral part in whether a person with mental illness had a chance at living a productive life. And often more than not, an individual of color was arrested or jailed, and prison became their home. Well, and clearly that is not housing. So how do you see us changing the cycle for these individuals? Because we know that it's just not the same across the board.
Well, great question, and thank you for having me. I've done a lot of NAMI Zooms, and whenever I do it, I always feel I'm at home. I'm with my people. So thank you for welcoming me back home to your group in Santa Clara. Let's just talk about the housing first, and then I'll talk about the issues that people of color face, which are really formidable. We just heard, two experts talk about housing in a kind of really eloquent way. I'll just mention the film that you just saw. You saw Todd, who lost his housing because he was not able to keep it and spent way too much time, in my opinion, in the county jail. And of all those people who I followed since, people say, what's happened to the folks in the film? Todd has done the poorest. In fact, I'm very, very sorry to say that I found out in the past 24 hours that Todd passed away. Oh. And I don't think it's any accident that the rest of the folks did fairly well in the film. And the one thing that Todd lacked, he had many problems, but the one thing he lacked was housing, which I think goes to the points that you're making so clearly, that it's not housing only, but it probably is housing first, because if you don't have housing, how the heck can you take care of all your other mental health needs? So I just want to mention that about Todd. In terms of the, whether we're talking about mental health care, psychiatry, the profession of psychiatry, in which there are fewer than 5% of professionals, people of color, or if we're talking about our society at large, I mean, we are in the moment when we're reckoning with our structural racism. And I think that permeates every part of our society. It certainly permeates our experience with people with serious mental illness. If you have a patient who has a serious mental illness, a Black patient and a white patient, very often, and this has been shown in studies, very often the same exact kind of presentation of symptoms in the Black patient, that person is given a worse diagnosis, given a worse prognosis, and is more likely than the white person to be sent to incarceration versus treatment. So I think that, in answer to your question, is a very big question, but I think that, how do we deal with the issues that not only psychiatric patients, but psychiatric patients of color face? I think, we have to deal with structural racism in ourselves, in our society, in my profession. I think also, I should also mention that, as we see in the film, we see a person of color who really rises to champion a cause. That's Patrisse Cullors, who not only co-founds Black Lives Matter in the course of making our film, but she also becomes a real advocate. I would say one of the major advocates in this country for people with serious mental illness. And we also, and I think it's no coincidence that Patrisse is a person of color. She really understands and appreciates in a very deep way that the rights of people with mental illness is really a civil rights issue. And by the same token, the first Surgeon General of this country, Dr. David Satcher, person of color, was one of the first and the few Surgeon Generals to really take on the issue of mental health right on. So, I think that we also see encouragement from the African American community. The other thing I would say is, you ask, how do we overcome this? I think that by doing just what we're doing, there's powers in numbers, there's power in fellowship. What we see from this organization, NAMI, is, I think, a great example of what people can do when they don't face it alone, but come together with others.
Thank you. Ali, as someone who lived in her car and struggled with drug addiction and severe mental illness, housing was a big issue for you. Can you talk about your experience a little bit?
Sure. So I think the first point that I'd like to make is that I feel from a different standpoint. I feel that housing is a huge issue, but without treatment, without proper treatment of medications and psychiatrists and hopefully, a therapist, it never would have worked out for me in housing, because if I had just been plopped in, I wouldn't have had any kind of resources and I would have been totally lost. When I was living in my car and doing whatever I had to do for money, it was like a hopeless, lifeless situation. And so people started to give me hope, but I was on the Section 8 waiting list for probably 12 years plus. And, the only time I ever even got communication from them, it was like 2 months late. So, I was very lucky. I come from a very privileged background. I had my parents as a backup, but it was still very challenging.
And I remember when we were talking, you said you saw many people who you knew on the streets that had come out of the jails, and they were actually worse off and in a worse situation for finding housing. Can you just speak to that a little bit?
Absolutely. A lot of the people that I was around, unfortunately, because of the drug and alcohol use, there was a big criminal component to my life. And so I was around a lot of people that were in trouble and in jails, and myself getting arrested quite a bit. And I would watch people come out of the jail system or the prison system, and they were totally institutionalized. And so once it started, they had to do footwork to try to find housing, they couldn't do it. It just didn't work.
David, if we're able to enforce parity rules for private insurers, do you see that as increasing the amount of clients that might be able to come to Momentum and their various programs as we go forward?
I would hope so. I mean, that'll be one of the indicators, I think, is that of the success of parity is when we start seeing increases in number of folks that are entering the system. We feel like we're already seeing some of that wave from the pandemic and increasing acuity and also initiation of symptoms and conditions, just from the stresses and all the different things that have gone on during the pandemic. So, but I think that absolutely will be one of the indicators of really success, right, of parity, is we should see more folks, because we already know that folks meet a level of sort of assessment for clinical criteria that would get them into treatment otherwise for both mental health and for substance use disorders. And they don't reach and they don't get treatment, right? So if once we see more folks getting into services, I would like to just, as we, and I know we're sort of time crunch, but I would like to say in this discussion, I feel like I need to say and mention the name Michael Tyree for us, because in 2015 in the jail, Michael Tyree, who had both a mental health condition and a substance disorder, was killed by correctional officers for not taking his medication. And I still recall I started essentially 3 days before Michael Tyree's death at Momentum. And I remember he had been referred to Momentum when we were looking for a bed for him. And I'm still left with something I read in the paper, was that it was reported that one of the last things he said was that he was sorry for not taking his meds. And again, I think that Dr. Rosenberg's seminal work in the movie shows that revolving door of in custody, out on the street, unstably housed, and then and in emergency departments, and then that revolving door. And it is absolutely imperative for us, as we see this tidal wave of folks possibly coming in, we're expecting to come in, that our system needs to flip. We need it to be more about recovery and wellness centric. It has to be about folks being able to get the care they need, get the housing they rightfully deserve, and move on and take care of our own. This is ourselves, it's our own families, it's our neighbors.
Thank you, David. Well said. Allie, I remember you telling me you had private insurance all the time, that you were struggling to, come back to get your, the treatment that you needed, and that you experienced real challenges. And for those who might not be aware or listening to this today, in California, you're better off being on Medi-Cal, the state-funded program, than you are with private insurance. You get better services and better treatment. And it's really a counterintuitive sort of concept. So Allie, you were caught in that situation. And can you explain a little bit the challenges that you had?
Sure. So basically, I was hospitalized many, many times. And after I would leave the hospital, I would be usually placed in a crisis residential program. And at that point, they would find out I had private insurance and usually say that I had to go, that I couldn't stay. And it was a huge challenge because, a person with private insurance doesn't have a case manager. They don't have an assigned psychiatrist right away. They don't have any kind of a social worker. And so I was completely lost, and I was having to contact the insurance companies with help. Thank God for my dad, he was still alive, but I was having to battle with insurance companies while I could barely get out of bed. And I was, going back and forth and just trying to find a decent provider.
Right. So you were caught in that, I'll be damned if I do, damned if I don't situation.
Correct.
Okay. So then that's why the parity regulations hopefully will become more in line with where they need to be in our state.
I think that it's true, since 2010, we've had ACA, Parity Act, so forth and so on. But, we've had enormous discrimination since. What we do have, of course, as you in California know better than anyone because of the lawsuit against United Behavioral Healthcare, we do have the ability to say, we're not going to take it and it's against the law. And I think that's been a great advance, and California's really led the way for that.
Yeah, I think recently we had a similar situation with Kaiser where they've recently been penalized as well. Let me go on and delve a little bit more into the criminalization of mental illness, which was a prominent theme in Bedlam. Now, Allie, when you were out on the streets, you had quite a bit of interaction with the police. Sometimes you were fortunate enough to have a CIT trained officer come to you. For those who don't know what that is, that's crisis intervention training. But other times you did not have that kind of an individual, and they were not as understanding at all. Can you talk to those experiences a little bit?
Sure. So I ultimately had, unfortunately, mostly because of the drug and alcohol component, I did have a lot of experience and exposure with the police. And I did encounter a CIT trained team of officers one time, and they were extraordinarily kind, and they were so helpful and treated me like a human being. That wasn't always the case. I was arrested at one point, and the officers saw that I was in some of a bit of a drug-induced psychosis. But unfortunately, not unfortunately, but whatever you want to say, I was sort of aware enough to realize they were making fun of me. They were calling me names. They were saying, oh, what a whack job, stuff like that. And so it was very, very cruel. And I was just demolished because of it. I was already completely down to my last, moment. And that really kind of sent me over the edge. And I also had experiences with the police because I'm very fortunate to come from a place of privilege. So I had encounters with the police where they would look at my address. They would see I was from an upper middle class neighborhood. I was white, and I would be treated. They would give me a ride home after something I committed, or they would just say, oh, you need to go home and talk to your parents. And I don't think that would have necessarily happened with a person of minority.
Well, and as we've seen in the film, that definitely didn't happen.
Right.
As well as what we see and read every day, either we read it or we see it in social media. Anybody of color, they're lucky to even end up in the jail. Half the time they're shot now. So right. I'm going to ask Ken then. The divergent programs. Did you witness any of that? I mean, you were there at Twin Towers in Los Angeles County. I guess that qualifies as the largest hospital in our country right now for mental health. That I guess unto itself says something. But what did you see? Were there any efforts? I guess Patrice was trying to make those efforts towards diversion programs and more outpatient assistance.
Yes, and I mean, in Los Angeles County, there really is a whole big effort now, partly because of Patrice, partly because they stopped building the jail, whether that's a good idea or a bad idea, we could debate, but as a consequence, they've moved the money that was going to go into the jail into community-based help. And there's a judge now, Judge Songhai, who I spoke with at the UCLA Seminole Institute. And there's a real effort to divert people out of incarceration into treatment. There are a couple of venues for this. One is that the mental health courts, where someone with a felony or even a misdemeanor conviction can be diverted. We see this in California. It's more developed, frankly, in other parts of the country. Much more developed in Ohio, much more developed in New York City, where I am. But the mental health court diverts someone who would be picked up for any kind of charge, often a felony, sometimes even a misdemeanor, and they would plea bargain, take a guilty plea, but then find themselves not in incarceration necessarily, but find themselves in treatment. And that's an incredible, extraordinary thing that saved Monty's life, if you ask me. I mean, Monty, was in that program for a year, and as a consequence, he had a job for the first time in years. He, as you know from the film, he had problems afterwards, but by and large, that was a very, very positive experience for Monty.
Okay. Well, you segued into a perfect question I was going to ask Jim, and then I'm going to ask a question to Allie. But Jim, so of course, California, here we are, 58 counties and pretty much 58 separate states. But we have assisted outpatient treatment, Laura's Law. And now we have a big change, I believe, where all the counties have to focus in on Laura's Law, and they have to opt out if they don't want to work under with Laura's Law, assistant outpatient treatment, if I understand that correctly. Yeah. So I'm curious, do you think that would be the start of a possible coordinated state trend, an effort to coordinate services? Because you go from, 2 miles away and you're a different county and the whole service program is completely different. So do you see this maybe as the start of some sort of coordinated effort?
Well, we worked, just responding to Dr. Rosenberg's comments, we in 2019 got the pre-arrest diversion law passed that I authored, working with Governor in 2018, working with Governor Brown. And it was quite a struggle. And what it means is, if somebody's picked up by the police, the DA and the public defender and the judge could hold the arrest in abeyance and then divert the person to go to a treatment program. And upon that agreement with the parties concerned, the arrest is not recorded. So they can avoid having an arrest record. And I think when we talk about incarceration, you have to realize in California, and I've been to 28 prisons, including the Twin Towers, the county jail course, and all the state prisons. It's now at the state level over $100,000 per year to put somebody in the state prison. And it's become way too expensive to put somebody with a mental health condition that caused them to go into the criminal justice system into prison, because it's even more expensive than $100,000 to take care of somebody with mental health problems in a state facility, probably another $30,000, $40,000. So why spend that kind of money where it's not really relevant to the therapeutic result that you want? Why not spend the money on a treatment program, housing treatment, getting good comprehensive care, and 50% of the funds could be reimbursed by Medi-Cal. Whereas when it goes into the state prison or the county jail, it's 100% general fund cost to the state or the county. It's a fiscally irresponsible thing to do to put somebody with mental health problems in the state prison or the county jail. So we have to eliminate things like, we have to have those diversion programs, get rid of bail programs for, it has to be reformed. And I think if we did that, there'd be a lot less people incarcerated that should be in mental health treatment and in the facilities, as the movie points out. And it's a racial discrimination issue also.
And Allie, when you were out on the streets, you told me you weren't even aware that there was a medical court option for you. Nobody even provided that knowledge to you at all.
Correct. I was trapped in the legal system for almost 16 years, and I had 2 felonies on my record. And anytime they knew that there was a mental health illness on board with me, however, I was never told that there was a mental health court. And frankly, I believe that if I had been referred to a mental health court, I might have not spent 16 years trying to have my record expunged and explaining to employers and not being able to get work, and all these different challenges that came about because of the criminal behavior that was directly related to my mental health.
Sorry, I was going to chime in. Psychiatrists don't know about mental health court. I
Oh,
very few psychiatrists that I come in contact with. I'm on faculty at Cornell, one of the Ivy League medical colleges of our country. And I think if I asked my colleagues how many people know about mental health court, I'd get just, a handful of yeses, if that.
The other thing, though, is I think that, one of the things that we're doing locally after the George Floyd murder, locally, our Behavioral Health Contractors Association has been working on is actually seeing if there's ways to get our local behavioral health crisis calls actually removed out of the law enforcement system and into a community-based system. And in working with the county, we've had NAMI support on this, and from our providers and with the department, again, is really looking at some of the things that have happened in our locally. Silicon Valley Debug, a community partner, their parent groups have talked about losing family members in a behavioral health crisis call, 911 call that goes south, and then their loved one ends up getting shot and killed. And part of it is we can build a better system. There are better systems that are in operation around the country, community-based. They've been vetted, and one that's being adopted nationally right now is the Cahoots model from Eugene, Oregon, and it's being adopted in many different places. We've called back to New York. There are 2 precincts with the highest number of behavioral health calls out of 75 precincts, police precincts in New York City, and they're using now these mobile teams, response teams, all staffed by peers, Allie. I mean, they're running, these are nonprofits that are running around with, in vans. They don't have an office. They just go call to call, and they are de-escalating these situations in the street. These are folks from the neighborhood, right? What could be, what could be more helpful than folks from your own neighborhood, people that have lived this experience? In the model, they have EMTs on the team. And we're very, very hopeful that Santa Clara is going to have a community response model in operation at some point in 2021. And it's going through its process now to request state assistance, Jim, and from the OAC. But we're really excited about it. And I have to say too that, I think law enforcement is looking forward to it as well, right? Because they, a lot of these calls, they feel like, there are other calls they should be going to. And then, if we could have this community response model, along with, a county mobile crisis response model, that would really then, allow them to go and go to other calls as well. And so there's so much of this that I think we're at really a critical inflection point right now.
And the 988 number, that should help then. Once we get what that number comes into play, we would be diverting less to the 911 officers and more directed towards the mental health needs.
Absolutely. I mean, and the community needs to know that they do not have to call 911 when when a family member or they see someone else in behavioral health distress. They can call this non-emergency number and trust that folks are coming out to de-escalate as best they can.
Is there anything else that, let's say on a global lens, Ken, do you have anything that you might want to include in that conversation that we're having about what do we need to make this work? We have examples out there.
We do. I mean, like the World Health Organization's exemplar for this is a little town in Trieste, Italy, which, they're trying to import some of the lessons into Los Angeles. Now, Trieste is a town of 220,000, as I recall. Universal health care, no drug epidemic. I think that there's a lot it has going for it, besides they have really incredible community mental health care. But, in Trieste and in a lot of places, they have no need for people to be arresting folks with mental illness. They have little need for hospital beds. I'm not sure how translatable that is to every jurisdiction in California or in the nation. But I think there are some really good lessons. And of course, you know, look, there's, as we talked about earlier, there's some big social issues that we have to deal with that are at the root of this: poverty, discrimination, systematic racism, those kinds of problems. And there are some medical issues, which I'm sure, you know, I would probably have some support on here. Of, you know, at least for people with serious mental illness, it'd be nice to have universal health care, so that, you know, that people get really good care. It's remarkable what you talked about. You have private insurance. Sometimes your health care is not as good for serious mental illness as if you have a public option. So anyway, I think those are the things that I would add to the discussion, but I imagine that there are things that you all know and hold near and dear to your hearts.
Thank you. And Jim, other thoughts on what else we can do to tighten, to create better parity and add better services?
Well, there has to be political leadership, and the leadership of President Biden and Governor Newsom has to be paramount to the actual success. So I would like to see a mental health czar at the federal government. I nominate Ken or David to do that, and if Ken gets appointed to the mental health czar by President Biden, then I nominate David to be Governor Newsom's mental health czar. So we need to have somebody that has this real broad-based understanding of a common sense solution. And I want to say this: when you do political polls, when you ask the public about mental health, it's like 90% people want something done and are willing to spend more money on mental health and substance abuse treatment right now. And it crosses party lines. It's a bipartisan issue. Mm-hmm. My experience in Sacramento has been bipartisanship on the mental health issues is very strong. So let's get a comprehensive mental health law in the United States and in Sacramento and fund it, and fund a full service program, including housing, treatment, building up our academic institutions so we can have more staff, and peer programs in all the other levels. Mm-hmm. So let's build the system up and provide good treatment for people, so we don't have the massive incarceration, we don't have the massive tragedies and the racial disparities in our country. It would go a long way to solving a lot of those problems that we have in the United States and in California. So plus, when people are healthy, they're productive people in the economy. And that's another thing I bring up. We have employer-based insurance, and if you aren't successful in your job, you go onto the Medi-Cal system. Why is that? The private insurance, when they fail, they simply pass the people on to the public health system. And so there's something wrong with that, I think. So we have to have a comprehensive system in the United States and in California. It takes a leadership. It takes leadership on the president and the governor, and somebody to give them strong advice. And I told the governor this, and at President Biden's advisors this also. I told the governor directly he needs to have somebody like this. So let's get it done.
I like that. Dave, do you have anything to add on to what Jim just said then, or?
No, other than I think Jim should be the czar, and I'd gladly be on his staff. I will, to sweeten the deal, I'm not much of a handyman, but I will go and help Pat if you could do that. I will stay local, and I will try to do handyman work for.
I'll do it for $1 a year.
Yeah, I mean, again, see, even more reason.
We'll do it for $1.
Yeah, more reason.
I think we have a rock, paper, scissors moment.
Yeah, but yeah.
Well, let me ask you this, Allie, as somebody who was needing of treatment, what would you like to see if you could have changed it for yourself at that time?
Sure. So the first thing I want to re-emphasize that a lot of people have said is that early intervention is key. I started drinking and using when I was 12 because of a sexual abuse, and it just progressed from there for many, too many years. And I'd also like to see, as everyone is saying, additional options for people with private insurance. That's, the bottom line. And I think that frankly, I was dismissed in some ways because I did have private insurance. And so the point that people were trying to make to me was, well, I had a backup. I had my parents' support. And I did. And that was a really great thing. However, my needs were just as intense and just as hard as any other regular mental health client. And that going back to what Jim said in the beginning, that discrimination, there was that kind of discrimination as well. And if I had had appropriate treatment when I was young, it might have saved so many years of heartache and using and just everything.
Thank you, Allie, and thank you for your candor. So the last question I want to ask everybody, because of what we're experiencing 2020, and we're still dealing with COVID in 2021, is I do think that at least mental health has come to the forefront. So I guess I'll start. Dave, what do you see coming out of the pandemic and hopefully moving mental health forward into a better position?
I mean, one, I think I'm encouraged in some ways by all the efforts to actually divert folks out of criminal justice, one through these community-based response teams. So that's one, is we can actually, again, not criminalize people acting out health conditions. I mean, I think that's key. And then we can keep folks in a responsive healthcare system that has the tools to use our evidence-based and also emerging practice as well. I mean, I think, we just need to be more nimble around using emerging practices. And with that, I think especially we need to it's been mentioned a lot today, by everyone on the panel, of really looking out and closing those health disparity gaps. These have been around for forever. I mean, as long as I've been in the field, and we've been working on them. And what we come to find in the pandemic is that the folks who are historically underserved are now most affected by it. It's like, yeah, we must close those gaps. I mean, it just so anyway, I mean, I feel encouraged actually in some ways. I think the film going and getting such widespread, views and awards really helps us carry that message out. And I think it's an important time to do. I mean, it's a vital time to do that. So it's good to be on this panel with these experts and skilled folks working it.
This has been a horrible disaster for the entire world and California in particular, but I think there are some lessons. And one of the things that's happening is telemedicine, which is democratizing medicine. Charlene McRae, First Lady of New York City, and I wrote a piece in the Washington Post about this very issue, that I think that, as a consequence, we're now able to reach people. Telemedicine was something, for those of you who don't know, that if you lived somewhere where there wasn't a psychiatrist for hundreds of miles, and you would go into a room, maybe in the ED somewhere, and you would go in front of a TV, and then you would talk to a psychiatrist in another state even. Well, now, Zoom has made that sort of, this is part of our how we do business. So I think that that's actually great, because I think that will really help us really reach more people. And I think that, there's probably ways to do that which are cost effective. But I do want to say before I leave, this is really beautiful, honestly. And it's just really such a privilege to be with you all. And I'll try to stay to the last word, but I can't leave my patient waiting too long or they'll get very, very angry at me. But it's really always an honor to be at these events. So thank you for having me, and thank you for showing the film.
Well, we're more than happy to have been able to do this, and actually on that note, I think that we really have talked about all the points that were critical and key, and also the themes of and aspects of the film. And I think that today's conversation basically puts another rung on the ladder for a mental health collaboration. And I want to thank all of you for being here today. And I'm sure I'm speaking for all of us when I say that, Ken, we are looking forward to your next documentary on the topic of mental health.
Definitely.
Really appreciate all of you coming today. And thank you so much for being who you are, advocacy, and helping to change and treat the way we look at mental health. Thank you all. Thank you.
Thanks so
Thank
much.
you.
Thank you so
Bye-bye.
much. Thank you.
Thank you.